Welcome back. I've been looking forward to this episode ever since I had my first conversation with today's guest, Kathryn Shaffer, Director of Innovation at the Thomas Jefferson College of Nursing and the co-founder of Fifth Window, a well-being and mental health social network and resourcing platform for nurses. She has a lot of insight to share about the critical role that sustainable joy plays in balancing the demands of nursing, and she unpacks the concept of trauma-informed pedagogy as an important part of nursing education. Trust me, you won't want to miss any of it, so let's jump into it. In this podcast, we're setting the table for some powerful discussions with nurses, allied health professionals, regulators, tech innovators, and other thought leaders across the globe. Welcome to Care Anywhere, the Global Health Workforce Podcast, brought to you by TruMerit. Hi, everybody. Welcome back to Care Anywhere. I'm your host, Lea Sims, and I am joined by Kathryn Shaffer today. So excited to have her on the podcast. We're going to be talking about nursing education, and nursing innovation, and specifically around the impact of mental health and mental health resourcing on our nursing workforce. And we know this is a hot ticket subject right now, so I'm excited to dive in on it today. Kathryn, welcome. Could you tell our audience a little bit about you before we jump in?
Sure. My name is Kathryn Shaffer. I am the Director of Innovation and an Associate Professor at Thomas Jefferson University in Philadelphia, Pennsylvania. I've been a nurse for over 30 years and in higher education for over 20, and I'm also the co-founder of Fifth Window, which is a well-being community for nurses to support their joy.
Wonderful. I love that last line, and I know we're going to jump in on supporting their joy. So I hope everyone will lean in on that as we go through today. You shared with me on our prep call that you had a non-traditional journey into nursing. We always ask our guests who come from a health occupation background, specifically nursing, what inspired them to get into the profession? How did they find their way into nursing and into a healthcare career? Because we have so many people listening that are, many of them considering a career in nursing, or they're new graduates or students. And so I'd love to hear what your non-traditional journey into healthcare, and specifically where you are today. How did you start out?
That's a great question, because I often tell my students that I didn't take the traditional path to get to where I am today. And that if you told me many, many moons ago that I would end up where I was, I would just laugh at you, because I'm the youngest of 8 children. My father was a truck driver. My mom was a factory worker. I had some siblings who went on to higher education and had degrees and careers and professions. And I had other siblings who had trades, very well respected trades. Yeah. So I didn't really have a great kind of direction, like this is what you're going to go and do. I went to college right after high school, and I probably had every career or every major that was listed at Temple University.
Me too.
If I tried it one a week, I think, like, oh, I like you, I like you, I like you, right? So I actually ended up with a degree in fashion merchandising. And I worked in a really wonderful place in Philadelphia. And I really did like what I did, right? I loved what I did, I should say. I loved helping people. I loved watching them walk into a store and just leave happy, because an engagement or an interaction. But it was always like there was this piece that was missing. It really wasn't fulfilling every day of my life. And one day somebody said to me, on a whim, you would make a great nurse. And I thought, you know what? I haven't tried that career path. Why not? Yeah. So I went to nursing school, and it fit, but not the way that I thought it should or would. It fit because I realized that nursing is a lot like my creative side. It's problem solving. It's really being able to think in real time and help people in their needs, right? So that's how it clicked. That's how I fit. And I loved working at the bedside. I was never going to leave the bedside. I had done that for several years, but then I came to this realization that nurses were more than just these like skills and task performers. Like, we could solve problems, but we were never asked to solve the problem.
Right.
And so I said, you know what, if I'm going to solve problems, I got to go figure out how to do that. And I ended up teaching. I went into education, and from there, I kind of said the same thing. I have to teach students when they leave me that they are problem solvers and this is how they do it. So I've been in higher education for, like I said, for 20 years. I teach an innovation class to my undergraduate students. And along the way, I also got really involved in population and community and public health because that's where you could use your creativity. Sure. So that's my current area of practice is really vulnerable populations in Philadelphia.
And problem solving, like you said. I know when we spoke before, you talked about the power of design thinking and empowering nurses and probably other healthcare workers as well, but nurses specifically, to engage in more design thinking when it comes to problem solving, evolving care models, looking at the way care and treatment is executed today and what it needs to be for care delivery of the future. When did you start seeing that need? When did you, maybe some examples of where you recognized the need to move from just executing on a treatment plan to sort of looking up from that traditional model and saying, there's some more creative thinking that needs to be engaged in here to solve for some of these issues, whether it's staffing issues or, some of the other things that you might have been seeing on the front line of care that you said, there's a different way we need to be approaching this.
I think just right from the beginning. I think when I first went into nursing and people would say, well, this is how it's always been done, I would say, but why? Like, why can we just try it like my way for a second? And if it doesn't work, then we'll go back to your way. But if it does work, maybe we can keep going with that. So I think I realized that immediately. But it probably became more impactful when I kept seeing the same patients readmitted time and time again for the same complications that they were experiencing. Like, why didn't we fix this? Why didn't we solve this problem? Why are they still experiencing, heart failure? Why are their sugars so out of control? Like, what are the pieces that we are missing? And I think that's when it really kind of took hold on me to say, okay, it's not them, it's the system.
Right.
And why do we keep letting people out into the system or out until I go back home? Then I started to discover lack of resources, education, the reason why they should really come back to the hospital. Like, where was that trusting relationship that a patient would say, you know what, I need to call someone because I'm not feeling just so great today, right? So I think that's how it all started and evolved.
Interesting too that you didn't really start seeing people pay attention to that until regulations around reimbursement for readmission cropped up, and all of a sudden everyone's like, oh, I think we need to solve for some of these problems because it's going to hit our bottom line. But you're talking about proactive creative thinking and design thinking to solve for some of these problems. Those are great examples, certainly. How do you approach that now when you're teaching your students to think creatively? I could go back to one of the things that I thought of when you were saying that is that some of it's a shift in mindset. There's a you use the phrase, this is the way we've always done it. And it not only does that speak to just, a pattern of a habitual or sort of ritualistic way of looking at things, but sometimes it's a mindset that needed to be empowered to think that way. I think we're seeing that shift in nursing now, but certainly for many years, it was about changing mindset first, and the culture has to change to equip nurses to have a voice, to be able to say, no, I can actually question that. I should actually push back on that and advocate for a different way of doing things. Is that what you've seen evolve, and is that how you teach your students now?
So back in 2014, the college that I currently work at was going through a curriculum change. At the time, our dean was like, you have a blank slate, whatever you can think of, dream it, and that's how we're going to do this, right? Yeah, at the time, very innovative.
Yep.
And my big, the soapbox that I got on all the time whenever we would have conversations were, we have to stop having students only do clinical in an acute care setting, because that's a sterile environment. They get all the meds they need. They see every physician that they need to see. They get every diagnostic test they need to get. And then we send them home and we say, okay, now you're on your own, right? And so I said, our students have to be able to, in the same semester, do a stint in acute care setting, but then an area of transition that would be very realistic for someone who was leaving the hospital in whatever they were studying, right? So if they were going home, could we put them in home health and the hospital? If they were going, to a rehab facility, could they be in a rehab facility and so the students could feel the transition that someone has to walk through, and then really understand, oh my goodness gracious.
Yeah.
Like, we are not even thinking about the fact that this patient doesn't have a scale at home, and we're letting a CHF patient go home, and they have to weigh themselves, but there's no scale at home, right?
Yep.
And so that was a really big part of me. And students in the beginning would just be like, just let us be in the hospital. Just let us take a blood pressure. Just let's give an injection. And by the time they got to their third semester, after doing these pieces of clinical and putting it together, I would have students say to me in my population health class, I just had the biggest aha moment. I'm riding the subway with someone that I've seen at the shelter. I see someone who's more alike than not.
Yeah.
And I was like, oh, like that's it.
Priceless
Like, that's all I wanted. Like,
yes.
I can go now.
Yes.
I can retire.
Yeah.
And so it took that kind of evolution for me to start to show students that, you know what, you're right. We are, just like Maya Angelou says, we are more alike than we are different, than we think we are different. And that once a student gets to understand that, I think that relationship building and that trust building becomes a little bit easier for them. When they become nurses, they still, they have this thing that I'm the nurse and you're the patient.
Yeah.
But when they start to see that this is not transactional, this is relational, right?
Yep.
There is a different way of thinking for them, and they start to advocate, I think, a little bit more, and they start to speak up a little bit more. And then in my innovation class, that's where I tell them, you are allowed to make mistakes. You need to make mistakes, right? Because that's how you fix things in the end. Yeah. And, it's a small pocket of students who take my class, but at the end, their ways of thinking are so different.
Yeah.
And that's really what I try to do in all of my classes with all of my students. It's, there's a reason why you're here.
Yep.
And we're going to figure this out, and you're going to use that as you move along in your practice.
I love something you said early on in that answer about, understanding the patient journey, right? I've seen that as a care provider of an aging parent, just the breakdown of understanding between the teams that are caring for that patient in one setting and not necessarily understanding what the transitional journey looks like for the patient as they move from setting to setting. My father passed of Parkinson's last year, and they were sending him to a step-down rehab hospital, and he wasn't going to be able to do any of the therapy that they were giving him there. And I said to them, if he can't do it there, he's not going to be able here. He can't do it there. But there was sort of a pass off, and I thought, you should go with him. I remember thinking many times, if you could follow him through this process, it would be very helpful. And I don't know if that's part of, the typical education or clinical training that nurses go through, but I imagine it would be helpful. I think we see hospitals and health systems focusing on the patient journey within their hospital from registration to discharge, but not necessarily mapping that out across the very complicated and nuanced care delivery journey that aging patients particularly have to take. So just a side note there, but it struck me as another sort of out of the box design thinking. Let's reimagine how we're orienting and training care providers beyond just their clinical skills, but to really understand relationally, how am I partnering with my patient from cradle to grave, really, across that ecosystem or across that continuum. I love that. Let's talk about, you've talked about innovation a couple of times, so it's a good time to pivot. This is some of what you're teaching your students and what you're really focused on. I'd love to talk about the J&J Hack for Health that you participated in 2020 that really became the springboard into the Fifth Window organization that you've founded now. Can you talk a little bit about that process and how you went through it, and then we'll talk about Fifth Window and the great work that you're doing there.
Sure. So, like everyone else during May of 2020, there wasn't really much to do.
Yes.
I had a friend reach out and say, "Hey, listen, Johnson & Johnson is having a virtual hackathon this weekend. I really think you should join. You might find it interesting." So I joined, and there were different tracks that you could be on, and the one about nurse well-being really kind of spoke to me. So I joined this group of nurses, and there were some there were some tech people involved who were part of our group, and we really wanted to focus on how do we support nurses and their well-being during such a stressful and really unpredictable time, right?
Yeah.
And we won our track. And we designed in the beginning an app that really just kind of provided space, very small, curated little practices that nurses could do just so that they could feel connected to a community of like-minded people. Nurses are very protected of their space. They don't like to share with other people if you're not a nurse because you don't understand what we're going through, right? They're very protective of their own, right? So, leave my people alone.
Yeah.
We got them kind of thing. And so at the time we were 3 nurses, and we found a IT person who was building our app for us, and we co-founded this company called Fifth Window together. We honestly, when I say that we bootstrapped and we did this all like with we really had no guidance, no business guidance. Like we knew what we wanted to do for nurses, but we had not a lot of business guidance. I have some from my previous career, but not how to start a C Corp and make an app launch in the App Store. We were very resourceful. We became pro bono clients of law firms who would take us on as clients to help us with our incorporating ourselves and building contracts and things like that. We were very blessed. Temple University has a student-run marketing company. So they took us on as a client and helped us with our logo. They helped us with our tagline. It was,
Wonderful.
all the different things, right? So we were trying to be as resourceful as we could. Right. And we were plugging along and we were doing our thing. And I guess it was about 18 months ago, we realized that there was something happening. Something was changing in the way nurses were responding to the whole burnout, compassion, fatigue kind of overload that we were hearing about.
Right.
And they were like, enough, we know. We know we're burnt out.
Yeah.
We know we need help. But when we came together as a group in any kind of forum, nurses just connected, and you could just see like a lightness, and I don't mean lightness in the air. I mean like something like they could breathe with each other. Yeah. The weight came off the shoulders a little bit. And we thought, you know what? People are craving joy. Yeah. People want to be connected to joy. So my co-founder and I did a lot of research about the difference between joy and happiness, and how do you cultivate it? Because happiness is a fleeting experience. It's like, you have a great steak dinner. That's happiness, right?
It is.
Right.
Yeah.
But you walk outside and you hear a bird chirping and you say, wow, like I could that's joy. Yeah. Right. So joy is really a profound gratitude that you have. Mm-hmm. And so a lot of things that I have been doing over the last year or so is really helping develop and cultivate joy. Our tagline now is Nurse Your Joy. We really focus on helping nurses connect more maybe to the emotional, the spiritual, the psychological, and even their professional self-care. We offer short Reiki experiences. My co-founder reads tarot cards. We really use the 5 senses method when we do guided imagery with folks and things like that. So it really has kind of sparked this movement. We make joy jars together, and we do all these different things, but that's kind of how it has evolved over the last 5 years.
Well, and you can understand, I'm sure this is true universally of nurses and human beings at any point in life, what you're talking about, but you could understand it being particularly important for the nursing profession coming out of the pandemic. And what we heard so much, and why I could so relate to what you said at the front end, because we've heard it often. Yes, we know there's a shortage. We know there's burnout. We know there's turnover. We know there's displacement of nurses that are leaving the bedside and pursuing other avenues for nursing. But the assumption has been that nurses were just tired of nursing, and that's not necessarily the case.
Exactly.
What they really needed was, I need something to offset. There's got to be balance between what's tugging at my soul, so to speak, through the pandemic, through just the normal day-to-day grind of, pouring themselves out completely. Nursing is such a top of the list of the most service-focused professions you can think of. And yet, when you're constantly pouring out, you need to also be filled back up. You can't operate from an empty cup. You can't pour out from an empty cup. So it sounds like to me that you guys are figuring out how we teach and train and encourage nurses as a profession to keep that cup full, because it's constantly going to be drawn from through these other experiences. So that's very powerful, beautiful. It's really, to me, Fifth Window is, focusing on what it means to thrive in the profession, right?
Yes.
And not just survive and grind through it every day. And certainly people can do that. So kudos to you for figuring out that is a huge missing element. One of the most fascinating things that you and I talked about in our prep call was the concept of trauma-informed pedagogy. In nursing education, which I feel like we could talk about for an hour. I'm a big believer that if we do not take the time to address things that are trauma related, childhood related, whatever, we take those things into every relationship and setting and scenario. And no, you don't leave them at home when you go to work. They come with you. They inform the way you think, process, act, react, communicate, defend, all of those things. So I'd love for you to talk a little bit about how that's shaped the way you teach, and why it's important to you that the whole person is being addressed at the nursing education level to prep them for what I think is one of the most demanding jobs on the soul, really, is nursing, because you're caring for people at their most difficult, traumatic, painful moments in life. And I just think it requires a whole nother level of resource from internally. So I'm going to stop talking about that, because I am so passionate about that as well. And I was so excited to have you on the podcast to talk about it today. But how is that shaping your concept of nursing education? And what does that even mean for our audience who may be new to that concept?
There are many things that have impacted, or I should say, how I teach currently today, how I look at my students, and how I create what I call transformational belonging, right?
Yeah.
I think two of the big things that are the forces that have shaped who I am today is my history, or I should say my work in trauma-informed care. I do because I work with some really vulnerable populations, and being able to help my students identify that it is not the person, it is what happened to them that has shaped them.
Yep.
And when I say that we're more alike than we think that we are different, the students, it starts to click. They see things in patients that maybe, right? And so during the pandemic, and when we came back from the pandemic, I saw in my students a lot that I saw in the nurses. I saw how it impacted them being home and having to learn on a computer, being stuck inside an apartment, being, right? I could feel that anxiety. And so a colleague of mine, Steve DiDonato, he's a psychologist. He is part of the nursing part of the nursing department at Jefferson. He and I do a lot of work together, and he and I started to address, or we wanted to address, trauma-informed pedagogy. We wanted faculty to see that when students are coming and they, are saying things to them, it is not an excuse. It is something they're really living through, and they're trying to navigate what they're bringing with them and what's coming at them at the same time. And they don't know how to negotiate that just yet. The other force behind why I believe so deeply and so passionately about transformational belonging is my children. You know, I have 3 biological children and 1 stepdaughter, and they're all unique in their own way.
Yeah.
And I would think to myself, how would I want a faculty member treating my child? Why wouldn't I do the same thing for my students?
Yeah.
So I look at them with a different lens. And then I see in my classroom that there are students who represent every spectrum of the patient continuum that I have ever taken care of, right? And they need to feel like they belong in nursing.
Yeah.
And so I am very passionate about creating spaces where students feel like they belong. And when someone feels like they belong, they show up differently, they engage differently, and they believe in themselves differently. And that's the space that I have now become very, very vocal about creating in not only my classrooms, but in this profession.
Yeah.
You know, I have an assignment in my intro to nursing class where students are asked to find a nurse from history or current day practice that kind of meets, you know, there's these guidelines they have to meet, and they have to do a presentation on that nurse. And I often tell them that there were certain nurses that we're not going to talk about, only because when we think of nursing, we immediately go to that nurse, that's the only nurse in there.
Yeah.
Or out there. They were the first nurse ever.
Yeah.
But there were nurses way before them,
Yeah.
and there have been nurses way after them. And when you see students who find nurses who literally look like them, and they never knew that they were nurses and what they had done for our practice,
Yeah.
it like I mentioned a couple of months ago on LinkedIn that I wrote a post that for the first time in my 20 years of nursing my nursing education, you know, history, I cried because I read students' reflections of seeing someone who they never knew looked like them.
Yeah.
And what they have done. And now they feel compelled that they have to continue that legacy so that people, right? So that's why I do it.
That construct alone of belonging, the environment you're creating, the model that you're building, without a single moment of therapy, becomes a healing of its own for these students who sometimes, I just think general population don't always know how much they're walking around carrying on the inside. And it isn't until they're in an environment that's different, that's safe, encouraging, and enabling and belonging, that knot sort of loosens up a little bit and there's an opportunity to heal. So to me, you're giving more than just knowledge to your students just by creating that space. They're more equipped and empowered not only to recognize those same things in their patients, which I think is so much a goal of that, but to go into those spaces more whole themselves and prepared to respond to those. So great. I don't know if you have any. You gave the example of the student on the bus, and not to put you on the spot, but do you have any other examples to share of how that's been enlightening for your students, or how they've seen that come into play even once they're out of your classroom and working, at the bedside? Just
So I have several stories
good,
I
wonderful.
can share with you.
Yes.
Well, probably the first story, like one of the first times that I can say I actually, like, there were these aha moments in my students' lives, right? I used to run a student-run wellness center at a local, it's like almost like a soup kitchen, but they offered more resources within this church area, right? And we were there. And they were engaging with one of I love this. It's called Broad Street Ministry. They believe what they call radical hospitality.
Mm-hmm.
So they wouldn't call the clients or the people who access their services, they would call them guests.
Yes.
Right. And the social workers were concierge. And so it was, it really changed. And so when my students saw this, it changed the dynamic. And I'll never forget, one of the first times we went there, one of my students, we'd go and take blood pressures and we'd check a feed. And a lot of times it was really people just wanted to talk.
Right.
Like no one, the they became like the faceless people. They're unhoused individuals. They sat on corners, right? And so people just walk by them every day. And so they just wanted someone to listen to them. And I had a student say to me, Dr. Shaffer, I didn't do anything today. All I did was like, take their insurance card and make it, I helped them get an appointment at the doctor. And I said, I think you did nothing, but you have done more for that person than anyone has done probably in their entire lives. One, you sat and you listened, and you weren't like, they weren't an oblivious face sitting on a street corner. And two, you had to navigate buttons to get to someone on the other end.
Yeah.
Do you think that they even remotely have the ability or the patience to do that?
Or the
Because
access.
the door has been shut
Yeah.
on their face every single time, and when they have to press another button, that's a door being shut on their face. And so it took this student to be like, oh yeah, you're right. Okay, yeah, okay, I did do something, right? So I had to give them like, okay, get in, stick an IV in them. You did something better, right?
But you gave them life another way.
Yeah.
Right?
I have every semester in my population health class, I have what we call clinical prep day, where I really get the students ready to go out into into the community and things like that. And one of the things I do is I get my students Narcan trained. I have some great partners at a place here in Philadelphia who come in, they train my students and they talk about it, and it's really, really great. And I've had students over, will email me over after a weekend or something like that, be like, Dr. Shaffer, just want to let you know that I had to use my Narcan last night. Can I get another one? And I would be, and I always say to my students, no questions asked. I don't care if it's for you or for whatever. Yeah. And the student went on to tell me that there was someone who they were coming out of the library 10 o'clock at night, and they encountered someone who was in trouble, and sure enough, they overdosed, and because of their Narcan in their pocket, they were able to revive them and save their lives, right? And so I was like, again, like, this is why I do it. This is why I do the things I do, so that you can feel empowered. You did something. And then, just recently, I ran into a student who I had many, many years ago in nursing school. And it's always wonderful to see them, because you never know, like, did they really like you when you're in your class?
Yeah.
Like,
Yeah.
what are you going to say about me now?
Yeah.
And they were like, I loved your class. It was so great. I always wanted to go into population health. And after did a few years in the hospital, I'm actually working in the community now. And I was like, all right, yes. Another one, another one.
Yeah. No, exactly. All of these stories, amazing. I know, very inspiring to our audience, I'm sure. I'd love to know, and so would our audience, I'm sure, a little more about Fifth Window. How does somebody navigate that? What is the service that you're providing, and how is it delivered, and how can people find out more about it and more about Fifth Window?
Yeah, so Fifth Window is free. You can go to www.fifthwindow, that's FIFTH window.com, and you can sign up for to follow us and all of our newsletters. We do live streams often. You can even go back and look at some of our old live streams if you want to get reconnected that way. We are working on an app. We're retooling the app, I should say, that so we can have more live events. But we're also curating some live and recorded events for people to join us with. So by just going to fifthwindow.com, you'll be able to follow us and all of the things that we are doing over time.
So it's a social network of sorts with a very specific focus, and people can get connected to your resources and become a part of that. I think that's great. Yeah. We're nearing the end of our time, so I would love your advice to nurses out there who might not be thinking about the connection between mental well-being and their clinical practice. Where can they start? How do they find resources? How do you start that conversation with someone who's just maybe head down in their work and not really thinking? I think it's probably impossible that people aren't thinking about their mental health these days, because it's everywhere. But sometimes we care for ourselves last, right? We're so busy caring for our patients, spouses, children, aging family members. All of those people, especially for women, tend to get the best of our resources, and we care for our own mental health somewhere down that list a ways. So what advice do you give to the nurses out there today about how to get started or how to start thinking about that?
Yeah, sure. So I'd just like to say that self-care equals patient quality and safety. Because if you are not fully there, things happen to your patients. So it's not just about caring for self, it's also being able to care for your patients. So when people say there's really no impact on patient care, that's not true, because if I'm distracted, if I'm not
Right.
fully present, if I'm not there, things can happen, mistakes, things can be missed, right? And that's what we really want to avoid. If you were working in an institution, in a hospital, every hospital has resources. So I say that if you really don't know where to start, the first place to do is to go to your human resources. Every hospital has what they called an EAP program, employee assistance program, that offer, like, 2, 3, maybe even 4 sessions free with a counselor. And then I'm sure they have other ways to get you connected to a counselor. By all means, join us at Fifth Window and follow us on Instagram, on LinkedIn, as well as our newsletter and our website. We have wonderful resources as well, and people that we've partnered with. But I think the first thing I'd like to say is I know that every nurse has another nurse who they trust their life with. And to reach out to that nurse to say, I just need somebody to talk to. I don't need you to fix my problems.
Yeah.
I just need you to listen to me and hear me. Just like I tell my students when I meet somebody, it's a patient. Oftentimes patients don't want you to fix their problems. They just want their feelings to be validated and heard.
Yeah.
And just like with a nurse, we just want our feelings to be validated and heard just as well.
Absolutely. I think that's particularly that last part, especially about reaching out to another nurse, friend, colleague, or mentor, is powerfully important advice for our global audience, because not all of the nurses out there globally work for hospitals. If we look at the State of the World's Nursing Report and how many health systems globally are investing in mental health resources for the nurses, sadly, it's not a very high number. We hope to see that, improve. So there are a lot of nurses out there who don't work in hospitals and health systems that have EAP programs or have formal mental health resources. We're very privileged to have them here in the States. But I think that advice about certainly connecting with Fifth Window, I think that's a powerful opportunity for nurses globally who may not have those resources within their health systems. But I don't care where you work in the world, you have a nurse friend or a mentor or a colleague. We hear it all the time from nurses on this podcast and in conversations we have when we were just at ICN in Helsinki. And it was such a powerful thing to see those nurses gathered together and the collective voice they have within their own countries and nursing associations and communities. Nursing associations, probably another avenue to pursue for nurses who are looking for it. Kathy, thank you so much for sharing this, because I think no matter where a nurse listening to us or other healthcare worker, because so much of this applies to allied health workers as well, and not just nurses, and to physicians. I mean, anyone who's in this, working in this ecosystem, I think this is such critical information to pause and say, this matters. Your well-being, your mental health, your attention to your own trauma and your, all of those things. It is critical, and it isn't just self-care. It's really it raises all boats. Our patients, our care teams, our delivery systems, when each person not only takes the time to explore that for themselves, but links arms with another nurse and says, we're on this journey together. I'm here for you. You're here for me. And I love that Fifth Window is here for those nurses as well. Thank you so much for joining me today. I feel like we could have a much longer conversation. We might have to have a part 2, because I think it's critical, and the timing is really powerful when we're hearing so much about it. And nurse safety is a whole nother issue that is relevant to this discussion as well. So we could probably come back and talk about that. But thank you. Thank you for being here, for sharing your experience and your insights and your passion for this area of education and training particularly.
Thank you very much. Thanks for having me.
Absolutely. All right, everybody. Thanks for tuning into this episode. We'll see you back. You can find this episode and many more at trumerit.org/podcast. That's it for this episode of Care Anywhere. Thanks for joining us. We hope you'll tune in for future episodes where we will continue these powerful discussions about our global health workforce. If you missed any episodes, you can find them at trumerit.org/podcast or by subscribing to our channel on your favorite podcast platform. Just look for our podcast logo or search for Care Anywhere to find us. Thanks again, and we'll see you next time.